Jenna Smith, and today I'll be telling you about drug addiction with a focus on fentanyl. What exactly is fentanyl? Fentanyl is a synthetic opioid pain reliever, and it is 50 to 100 times more powerful than morphine. It can be made illegally or be prescribed by a doctor. It treats pain, usually in terminally ill patients. Alternate names for fentanyl could be Duragesic, Subsys, Abstral, Lonzis, and Sublimaze. Those are brand names. And then street names could be Apache, China Girl, China White, Murder 8, TNT, King Ivory, Tango, Cash, or Dance Fever. The methods of use include disc, which is a sustained release, which is designed to release the medication over a long period of time. Liquid, which being nasal spray, or oral method, which could be like a liquid that you swallow. It could be a solution in patch form. Most terminal ill patients that have cancer use patch form, and it can be injected. It can be used for anesthesia, for surgery, pain relief before, during, and after surgery, terminally ill patients, as I mentioned before, and it can be used for people who are physically tolerant to other opioids, so they turn to fentanyl. That's a fentanyl patch. That's an injection that you inject into your bloodstream, and that's crushed up pills. The history of fentanyl. It was first developed by Dr. Paul Janssen in 1959 by his company, Janssen Pharmaceutical. The anesthesia method came first around the 1960s. The fentanyl patches were next, which came around the 1990s, and then the oral methods were next. Today, a soluble film method that is placed on a disc is now in effect, which is placed into the mouth and absorbed, and it can prevent crushing and inhalation. Drug effects on the brain. So this is the main topic of the presentation. So the drug fentanyl binds to the opioid receptors in the brain, which are found in the areas that control pain, emotions, and the reward system. There are 3 subtypes of opioid receptors, which includes mu, kappa, and delta. Opioid receptors are triggered by endogenous peptides, which are released by neurons and alkaloid opiates. While the drug binds to the receptors, dopamine levels drive up very high, causing many side effects. Dopamine is a neurotransmitter which sends messages to other nerve cells to the body and tells them what to do. It interacts mostly with the mu receptor, which is not only located in the brain but in the spinal cord and on the tissues. This is a video that I will show on how fentanyl affects the brain.
No, it's nothing like that. Fentanyl is a powerful synthetic opioid. Basically, it's a painkiller like morphine, but a lot of people are taking it recreationally. The latest person to die is a 17-year-old.
Traffickers adding fentanyl to everything.
Fentanyl, that's the drug that contributed to his death.
It's being called a nationwide disaster. This is enough to kill a person. So how exactly does it do that? A lot of how drugs affect people is how fast they get into the brain and how much gets in. Fentanyl's good at both. Your brain has things called opioid receptors. Those normally taken chemicals your own brain makes to help you when you're, say, running a marathon. But fentanyl bypasses that system, floods the receptors, killing pain and easing anxiety. But fentanyl has side effects. For one, dopamine's released more easily. Dopamine's associated with reward, so it makes you feel really, really good. Drug users like that side effect, but other side effects can kill you quickly. Remember those opioid receptors? Well, you also have them in your brainstem. When those receptors get flooded, they tell the body to slow down its breathing. And because fentanyl is great at getting a lot of chemical into the brain really fast, those receptors can get overloaded easily. Too much chemical and the body turns off its natural breathing reflex. Breathing can stop within seconds. The person goes unconscious, and without help, they die.
So effects on the brain continued. Fentanyl must pass through the blood-brain barrier, which is a barrier that keeps harmful substances out of the brain. And fentanyl must pass through the blood-brain barrier because it is a CNS drug, which is the central nervous system. Fentanyl is also a non-polar molecule, which makes it easier to pass through the blood-brain barrier, easier than morphine and heroin. So, effects on the body. It gives you relaxation, euphoria, which is happiness and a state of excitement, and reduced feelings of pain. Side effects that occur with fentanyl may include nausea, vomiting, constipation, altered heart rate, slowed breathing rate, hallucinations, and much more, as you can see. One of the main effects that fentanyl causes on the body is tolerance. The body becomes so used to the drug it needs higher doses to feel the same effect as it first did. The opioid receptors are responsible for controlling breathing rate and respiration rate. And also, fentanyl takes over the limbic system, which is responsible for controlling making decisions and emotions, memories, arousal, and stimulation. Fentanyl also stops normal production of norepinephrine and depresses the central nervous system. Chronic long-term use of fentanyl can deteriorate white matter in the brain, which is responsible for decision making. So the addiction process. It starts with a certain amount given to the person, either prescribed by the doctor or illegally taken. And then the person takes more than prescribed because they like the feeling it gives them. And then it creates a feeling of relaxation and happiness, like I mentioned before. And as that goes on, they increase the dosage because the dosage that they once had no longer works now. So they can get the same effects, and they can't go a day without it or they'll have withdrawal symptoms. So addiction is official. Long-term consequences of taking fentanyl is poor judgment in relationships that deal with personal or work-related, damage to the tissues and organs from oxygen deprivation. They trigger pre-existing medical conditions or could cause new medical conditions. And also, overdose can be a short-term effect and a long-term effect. So the overdose effect. It can happen the first time you take it. So just because it's first time, people shouldn't think that they can't overdose. There's an increased risk to overdose if you mix with drugs or alcohol. Respiratory depression and cardiac arrest are the two main reasons for overdose after overdose occurs. Any increase in dosage is fatal. The user puts so much damage on opioid receptors that control breathing and heart rate, it cannot take the pressure. Dosage of fentanyl that causes overdose is hard to determine because everybody's different with age, height, and weight, and overdose does not always kill someone. Overdose can cause oxygen to be cut off to the brain, and brain damage can result. Brain damage from oxygen deprivation is called hypoxia, and it is said that 90% of people who suffer from overdose and brain damage will not fully recover. An overdose victim must be taken to the hospital right away. Stomach pumping may be necessary to get all the fentanyl out of the person's system. Narcan is given to act as a counter to the fentanyl to bring the central nervous system and respiratory system back to normal. Now the recovery process. Rehab is essential to be committed fully to getting off fentanyl. A detox will be performed, which is an intervention to keep someone off of fentanyl while managing their withdrawal symptoms. Therapy will be provided for not only the fentanyl addiction, but for nutritional wellness and physical wellness as well. Also, the family will be provided with therapy to deal with the broken relationships that occur. Like I said, family will be provided with therapy to deal with the broken relationships from the addicted family member. And outpatient and residential rehab centers are two options. Outpatient is where you have appointments and you come in from time to time. And residential is where you stay for treatment for a certain period of time. Relapse of fentanyl addiction. So, drug addiction is a chronic brain disease, and it can be treated, but it can never be cured, and that is proven. People, places, and certain situations can trigger relapse of fentanyl, and it is said that 91% of people who are in recovery will experience relapse, and 59% will relapse in the first week that they get out of recovery, and 80% will relapse a month after. So just some important facts, interesting facts. Fentanyl has affected popular stars in America, including Prince, and he actually died from fentanyl. And there has been 20,100 deaths from fentanyl in 2015. And the death rate has risen not 100%, but 540% over the past 3 years. In North Carolina, there was 300 deaths alone in 2015. And the street price for fentanyl goes from $20 to $30 a pill. And if it's prescribed by a doctor, it depends on your insurance, how much that'll pay. But it costs a lot. That's just a picture of a drug addict. So this chart, it says in New Jersey, 49,000 prescriptions for fentanyl were filled in 2014. One for every man, one for every woman, and child in Patterson. And New Jersey doctors gave out 1.9 million days of supply of fentanyl to Medicare patients in 2014. And that's enough to supply the population of Hudson County in 3 days. And that whole thing cost $13.8 million. This is a chart of fentanyl, heroin, and combined related deaths by the month. So you can see fentanyl is in orange. It had about 15,000 deaths, 27,000 deaths. It was a lot.